So we're gonna talk about ruptured globe and penetrating ocular injury. For the symptoms, the patient will come with pain, usually with history of trauma, decreased vision, loss of fluid from the eyes, not only trauma, maybe falling or any sharp object that could enter the globe. And here you see a very obvious picture of a teardrop sign, we call it, and we'll talk more about that in the signs. So this is another picture. You can see a ruptured globe, typically showing flat anterior chamber, iris prolapse, and peaked pupil, which is the teardrop sign that we talked about. So we've got critical signs, which is obvious for open globe, if it's full thickness scleral or corneal laceration, severe subconj hemorrhage, AC is deep or shallow, as we talked about, peaked or an irregular pupil. Sorry for the mistake here, I meant it has irregular, as well as other signs such as lens material or vitreous in the anterior chamber, foreign body tract or new cataract in the lens, maybe even limitation of the extraocular movements, particularly in the direction of the rupture, and intraocular contents, they may be outside the globe. These are all critical signs. Now for the other signs, you can have low IOP, iridodialysis, cyclodialysis. Usually the intraocular pressure can be normal or even in rare cases increased. Hyphema, periorbital ecchymosis, vitreous hemorrhage, dislocated or subluxed lens, retinal detachment. But these retinal breaks, they can be often obscured by vitreous hemorrhage. So these are the symptoms and the signs we talked about. Okay, how do you treat it? Well, first of all, once the diagnosis is made, further examinations should be held back until the time of surgical repair in the operating room, because you'd want to avoid putting any pressure on the globe and risking extrusion of the intraocular content. So the diagnosis should be made by pen light, indirect ophthalmoscope, or if possible by slit lamp examination, with of course very gentle manipulation. Once you have the diagnosis, you need to do the following. First of all, protect the eye with a shield at all times. Do not patch the eye, because when you patch the eye, you apply unnecessary pressure, as I mentioned earlier. Second, do CT of the brain and orbits, because you also want to rule out foreign bodies in most cases. You should get an axial and coronal views, 1 mm sections. Thirdly, you can do a gentle B scan. It can be needed to localize posterior rupture, or also to rule out foreign bodies that are not typically visible on the CT scan, non-metallic like wood, for example. However, it should not be done in patients with obvious anterior rupture, because you don't want to risk extrusion of the intraocular content. So a trained ophthalmologist should evaluate the patient before B-scan or any other manipulation on any patient who has a ruptured globe suspect. Now, of course, you should admit the patient to the hospital with no food and drink. Keep him MPO. Patient should be on bed rest, i.e., no bending over or Valsalva maneuvers. He should be on systematic antibiotics. Now, here are the systematic antibiotics that you should give to the patient. I've added them here straight from the textbook, so I wouldn't bore you with it. You could also give tetanus toxoid, PRN, and you can give antiemetics. Why? Because you want to prevent Valsalva and possible expulsion of intraocular contents if the patient suffers from nausea and vomiting. You can give the patient prochlorperazine, 10 mgs, IMQ8. Of course, you can also give the patient pain medication. You should know the last meal of the patient because the timing of the surgical repair depends on it. And last but not least, actually last and most importantly, is to arrange for surgery ASAP. Here you can see the OTS, which is basically the ocular trauma score. You can see how you can calculate it in these pictures here. Other notes that we should mention is that in any severely traumatized eye, when there's no chance of restoring the vision, inoculation should be considered initially or within 7 to 14 days after the trauma, because you don't want sympathetic ophthalmia to happen, which is a rare but an occurrence that could happen. Infection, of course, is something more likely to happen if there's a dirty injury or if there's a retained foreign body in the eye, or if there's a rupture of the lens capsule, or even a long delay in the surgery until the surgery is performed. Some groups recommend IV antibiotics in these patients where infection is more common. And that's it for Ruptured Globe. Thank you.